that require through coordinated entry. So currently for those vouchers, and there still are some, we're doing the move on process. So people are putting people on to the transfer queue. And if your team doesn't know how to do that, check in with Nancy, because she can train folks on how to do it. But people are doing it from a housing program. And then there's a specific kind of like box to say we're interested in Section 8. And then on every other Tuesday, we decide based on availability and sometimes what that person wants. There's not much of a difference between the vouchers, but if it's going to be Hackham or county. And then additionally, so that's the process for getting in. Additionally, Hackham is currently going through its wait list of 6,000 people, and they have a homeless preference for that wait list. But you have to have been on the wait list before. So the instructions were to call, if someone was experiencing homelessness, to call Impact. And we have been verifying that homelessness. If they're currently in shelter, we've been just writing a letter right away. If they say that they're outside, we're getting the location and partnering with Street Outreach to find that person, and then writing the verification letter if we find them. So those are the two processes that are currently in place. And then I added in a little bit about how, like, a strategy that you could use if you have someone who's in shelter that is, low service need, but you are interested in figuring out how to get them into the Section 8 process. We don't have, at the moment, we aren't just like taking people from the housing queue into any of the Section 8 vouchers, but I did, in that email I sent out to the group, attach our rapid exit packet, which is through Guest House. That doesn't come through coordinated entry. There are expectations that the person needs to meet. So it's meant to capture people that are low service need, just need a little hand up into housing. And that program is short term, so like 1 to 3 months. So you could potentially, if you have someone where you're like, they could benefit from Section 8, but they don't really need services, you could do rapid exit and then right away put onto the transfer queue. And then as the rapid exit program is working through and getting to know the person a little bit better, we could switch gears if we need to actually bump up to a different service level, or maybe we stay the course and they also plan on Section 8, or maybe they decide that they don't need it for whatever reason. And so that's a way that you could kind of do both things, get folks housed, but then also do a move on from a housing program. I don't know if there are questions that people have. If people have questions about any of that.
And just to give folks an update on the EHV vouchers, as far as the ones that are utilized and leased up. And I'm going to put on the, you may have seen this already, but for those of you who haven't, there's HUD has a link where you can actually see which how communities are doing with leasing up their vouchers. And we are the county's vouchers, they've leased up, and correct me if I'm wrong, Eric, but 52 out of the 63, and Hackham 43 out of the 121. So that's you can keep track of that on the dashboard, but I think it's something for us to, especially on the Hackham side, to look at and see how we can support them. I know there's been some struggles. I don't know, Emily or Eric, if you have any other insights on,
I do.
on that.
I do.
Yeah.
So there's the reason that Hackham is so low is because there's a bunch of people from the summer that we handed packets out to that are incomplete, or just we don't know where that person is. And so Hackham wasn't releasing new. They weren't giving information about like, yeah, we need more, because they in theory had these folks that were going to use those vouchers. And so when coordinated entry fully, so now we're meeting with Hackham once a week. That just started a couple of months ago, if that. Anyway, a few weeks ago anyway. And we made one final push to the contact person for everyone with those incomplete packets, with a deadline of completing that paperwork by June 1st. And whatever came back was great. I don't think, I'd have to check in with Erica. I don't think that a lot came back. I think that they were these were people that had fallen off. It's been almost a year. And so those are now released back to coordinated entry. So we'll now have more availability. So it appeared on their end like they had more vouchers filled than they actually did, because they didn't have full paperwork and then they couldn't lease up.
Yeah, and the problem is you can't release the voucher until it's like 120 days. So you essentially have people who are in the wind, but you're not allowed to even like apply for a waiver on these to say we can't find the person, can you re-release the voucher? So that definitely held things up as well.
Okay. Well, I appreciate that. Appreciate that insight. Any other questions on the vouchers? I'm sorry, quick question. Who's the 1214 cell number?
I believe that's Helen.
Okay.
I'll mute her.
Thank you. Any other questions?
It's Helen.
Thanks, Helen. Any other questions?
Yeah, just a quick question. Does somebody know, does the rapid exit program currently have openings?
They do.
Okay, got it. Thank you.
Mm-hmm. They would love applications. Send them away.
Awesome. Okay. Well, Emily and Eric, thank you. Both of you guys both been heavily involved in this process. And getting vouchers, out the door and working with Hackham.
It's good. I'm excited truly for the flow that the potential flow that we're creating here.
Yep. Yes, absolutely. It's going to be, I think, have a huge impact in our system. So appreciate that. All right. Why don't we move on? Shelley, I know we talked today about the planning process, but also we have some updates on the conversations we had at the last committee meeting. And I'm gonna hand it off to Shelley to kind of give us an update on where we're at. And she's
Sure thing.
Share her screen.
Hi, folks. Let me make this as large as possible.
Thank you.
So throughout the planning process, recommendations were developed, some of which have funding implications. And in recent months, this full group has identified priorities to implement. And as you recall from our last meeting and from the handout that I sent out, there were 3 areas of priority. Here they are: safe, affordable housing, housing support services, and COC structure. And we identified both short-term and longer-term issues to work on, or I should say recommendations to implement. So I sent out a survey, as hopefully you all know, asking for people who are interested in serving on task teams to flesh out these areas, especially starting with the short-term areas. And here's where we are. Hopefully everybody can see that. I'll make it even a little bigger. So for COC structure, we have Carl, Emily, Steve, and Cody. And I'm recommending as leads Emily and Carl. Now, some of the folks who are identified as leads were recommended by the group. So again, these are largely the results of the survey that I put out. And then we have housing support services with Wendy, Jessica, Ashley, and Eric. And I'm suggesting Wendy and Eric serve as sort of the co-leads. And then finally, we have safe and affordable housing. Andy, Tim, Clarissa, Audra, and Donna. And I'm suggesting that Donna serve as, I just seen a message, but I need to just hold on. Okay, so I'm seeing Donna, and we'll still need another co-lead for that team. And then I also asked folks to let me know, sent this out yesterday, and asked you to let me know if you didn't want to serve, if you were identified, or if you had concerns with the group that you were assigned to or whatever. And I did hear from a few folks and made some adjustments. So here's the plan that I'm proposing. For each team, make sure that you agree on co-chairs. So especially for that last team, the team will have to identify another co-chair. Of course, that's assuming Donna is willing to serve. And then if you feel that there are additional people who you need to involve in the team, to reach out and do that. Of course, do that quickly. We're asking you to meet at least once before the next leadership meeting. Did I get the date right on that? Anybody?
Yes.
Okay, thanks. So we're asking you to review documentation of work that has already been done by the planning task force. So you're not completely reinventing the wheel. There's certainly information and summaries of discussions, and again, the basic recommendations that the planning task force has already done. So there will be some information to be reviewed and ready for you. And we're asking that, oh, I'm sorry. And I'll be sure all the team members have that information before Monday. So we want the groups, each team, to prioritize what's in, especially their short-term list. There may be something that they want to work on sooner than something else. So look at the list in your short-term column and identify sort of your priorities to work on. If there's information you need beyond what I'm sharing with you, you'll need to identify what that is and then request that information, or identify any other resources you need to do your work. And then be prepared to report on progress at the July 14th meeting. And it'd be very helpful, I'm sure, to the full initiative, that those reports be verbal and written. Nothing fancy is needed, but certainly something in written. And then be prepared to talk about, you know, what the team's priorities are, what it started to work on, anything it's already defined. So that's the process. And I think we're hoping to make good progress on the short-term issues by the end of July. I'm sure not everything will be fleshed out by then, but since some of these issues carry implications for funding, it would be useful to have some recommendations, especially on funding, available as soon as possible. Any questions?
Yeah, Shelley, I would just recommend, I put it in the chat, that somebody from the housing division, either me or Jessica, be on that affordable housing group. And you know, I think it's important for two reasons. One is, you know, obviously our home allocation is much smaller than the cities, but we have one on the ARP side. And number two, you know, we have $15 million of ARPA money that just got approved for development. And a number of those developments, we are trying to carve out space for this population within the COC, and working with COC partners for those units. And so I think it would be, in just my opinion, advantageous to have one of us on there.
That's a great idea. And that's the safe and safe, affordable housing, right?
Yeah.
Okay, great.
Well,
Eric, are you willing to do that?
Yep, absolutely. Yeah, I talked to Jessica a little bit about it too. So.
Very good, thanks.
I can switch, if you want to move me then to Housing Support Services, I could switch with Eric then.
I like that, Clarissa.
mhm.
Great.
Emily made the suggestion of having Eric co-chair. If we can then find somebody to co-chair with Emily or with Wendy, and that makes sense to me as well.
Let's take. Okay,
Clarissa, you want to co-chair? I'm putting Clarissa on the spot.
I can make it work, yeah.
so it would be Wendy and Clarissa.
Thanks, Clarissa.
You're welcome.
Great, I'll make those changes. Anything else? Let me know if you have questions. I will be on medical leave starting the 13th for a number of weeks, which is why I want to get everything that I have that I think you'll need to you. But if you think of anything in the meantime, I'll be working this weekend. Just let me know. But again, I'll be getting you reports from previous work done, summaries of conversations from the planning task force that sort of gave rise to many of these issues.
Yeah, this is good. Thank you, Shelley. Yeah, we'll obviously we'll be involved too. We'll serve on these committees from the city's perspective to definitely support this. Okay, so I'm looking at the Safe and Affordable Housing Committee. Is there just to, and again, you guys can discuss this at your meeting, and we're asking, right, Shelley, I think you already mentioned this, but folks to meet before the 14th to at least and start working on those short-term goals.
Yes.
Is there anyone that's on this call that's on the Safe and Affordable Housing group that would be interested? I don't want to put folks on the spot, but serve as that co-lead. If not, you don't have to decide now, but just.
Donna, are you willing to serve as one of the leads?
Yes, I am. I'm sorry, I was been quiet. I didn't read everything before the meeting started, so I was reading while you all were talking. I'm happy to do that. I don't have a lot of availability for the rest of June, and then the holiday hits in, so it might be sort of a last-minute meeting, you know, right before the next COC. Eric, are you interested in co-leading that with me? Because I think
that sounds great.
All right.
Yeah, absolutely, Donna.
Cool. I'm also interested in asking one of my staff to join the Housing Support Services Committee. Is that all right? I've reached out and she hasn't responded yet. I was going to ask Lori if she could join that one. Is that okay?
It's absolutely up to the team if they want to add folks, whoever you think will be helpful. Absolutely.
Great. Thanks, Wendy. Yeah, I just think more for learning the process, as well as offering the input for what we've been doing.
Good, good.
Thanks. Eric, I'll reach out to you separately and we can figure out a startup plan.
That sounds great, Donna. Thanks.
Awesome. Thank you, guys. Appreciate it.
Anything else?
Okay. Well, again, Shelley, thank you. Thank you so much for putting all this together. And this feels good to start really digging deep into this and coming out with some recommendations and some good outcomes.
Great. I look forward to seeing what evolves.
Excellent. All right. If no one has any other questions on this, we will move on to the next agenda item, which is Emily Whitcomb. We invited Emily from Milwaukee County. I know we've had some conversations in past meetings, really talking about how do we as a COC start creating more opportunities for us to partner with local healthcare systems. The county's been doing, some of this work with the healthcare systems and HMOs over the last couple of years. And we've invited Emily to talk a little bit more about what she's been doing at Milwaukee County, specifically on some of these partnerships. So I'm going to pass it on to Emily, and then we can see if there's any questions and go from there. So thanks, Emily, for joining us. Really appreciate it.
Yeah, of course, thanks. I am going to share my screen. I did research how to share a PowerPoint and still be able to see your notes. I'm not as familiar with Zoom, so we'll see if this works. If I don't have my notes, I'll simply read the slides and hope that you all glean what I meant to say.
We can see it, Emily.
You can.
We
Okay.
don't see your notes, or at least I don't.
Oh, okay. So, here, I think I can change the size of this. Yes.
That looks good.
Okay. I've never shared a presentation on Zoom before, so apologies for that. Yeah, so good morning. My name is Emily Whitcomb. Thanks for the introduction, Raphael. I work for the Housing Division, and I've been working on a project for the last 3 years in partnership with the Milwaukee Healthcare Partnership. The Milwaukee Healthcare Partnership is a consortium of the community hospitals and federally qualified health centers, as well as Bread for Healing, which is the community's only safety net clinic. And their role is to increase health access and improve health outcomes for low-income individuals in our community. They understand that in the realm of social determinants of health, housing is one of the biggest indicators of health outcomes for these individuals. And so they sought a partnership with the Housing Division to provide housing to this population. It was modeled initially similarly to some of our HMO partnerships, but it was always my goal to provide services and build the program from a system level perspective. The health systems are really complex, but I think that the work that we did with them, especially over the course of the pandemic, has really uniquely positioned us to integrate them into our system. We built a lot of really good rapport and trust over the last few years. So the way that it started, we worked with Frederick, Aurora Sinai, Children's Wisconsin, and St. Joe's. And in the beginning, what we were doing is we were receiving referrals from hospital social workers, and I was actually going bedside at the time to complete housing assessments and make connections with the patients. And the goal of that was to secure shelter placement, help with discharge planning, and then eventually work with those patients to secure either temporary or permanent housing solutions. And we also did quite a bit of helping people self-resolve with family members, or just sort of like troubleshoot through their program, similar to their situation, similar to some of the work that Impact 211 does. One of the big goals for the healthcare partnership was to demonstrate efficacy and for cost savings for our Medicaid system, so that we can try to work with the state on creating a Medicaid waiver to help pay for some of these services. The target population was, at that time, was just people who were admitted inpatient or in observation, and then only category 1, with the exception of our children's population. So one thing that our children's partners recognized pretty early on was that they didn't really see a lot of Category 1 families in their system, but they did see a lot of Category 2 need. And so a little bit later on, we started working, instead of working in the inpatient or ED setting with Children's Wisconsin, we started working in their Midtown and next door clinic where they were identifying families in Category 2 situations. The measures that we were looking at early on was reducing the inpatient length of stay, readmissions and emergency department visits from individuals. As you are aware, one of the biggest issues for people being discharged from the hospital who are also experiencing homelessness is that they just don't have anywhere safe to go to. And they're not typically prioritized for shelter because they're not outside. So we were able to do some advocacy on that to make sure that people were not staying in the hospital for 3, 4, 5 extra days at a time, which is costly for the system. So this demonstrates our outcomes from 2019 to 2021. I think they're about as good as we could expect given the upheaval that we all experienced during the beginning and height of COVID. And during that time, our program flow largely went out the window. And what we were doing for the beginning and height of COVID is that we were actually working with the emergency hotel program, trying to improve the throughput for hospitalized inpatient homeless individuals so that we could free up needed beds for COVID patients. But for the outcomes that we do have, all of these outcomes were funded by philanthropic dollars from partners like the Green Bay Packer Foundation. And then also we had some money earmarked from the United Way from their family initiative for the Children's Midtown Clinic. I think we had particular success with the Midtown Clinic. Just in about a year and a half, we served 29 families, which included 76 children and 33 adults. All of those families were navigated to either a temporary or permanent housing situation. And all of those families to date are still housed. So that was wonderful. And I think the thing that really made the difference with the clinic versus our ED and inpatient partners is that we had like this ongoing partnership with the clinic staff. So if I couldn't get a hold of mom or what was going on, I could call up the social work staff and say, hey, like, do they have any appointments coming up? Can you do some outreach to the family? So having like the bringing that health care team onto the housing team and bringing the housing team onto the healthcare team, I think is what really helped us have a lot of success. And so that really motivated us in this year to expand to our 5 federally qualified health centers this year. So we've been doing that. So we identified a lot of problems during this time. The scope of need was really intense. There was a really poor understanding of the housing system for frontline staff. It's really confusing. We had limited subsidy, and then also because this program was being run like exclusively by me, our ability to collect robust data and accurate data was pretty difficult, especially during the chaos of COVID. We were completely disconnected from the rest of the system, and in general, I felt like there was just too many cooks in the kitchen. But COVID did a lot for the program. It helped us understand more deeply the disconnection and dysfunction that our hospital partners were facing when trying to access certain services. And then the rapport that we have with hospital leadership and frontline staff helped us get a lot of buy-in for where we're moving next. It felt like at one point, every hospital social worker in the county had my phone number, and I was doing a lot of discharge planning as my job. So we needed to tighten this up a little bit. So we decided that the best way to do that was to create a partnership with Impact. So I really wanted to tie the program into our coordinated entry system. So I started working with Erica a little over a year ago to map out how that might look. And also during that time, we crafted 2 new positions. So we have funding from the Healthcare Partnership for an additional housing navigator, which has been enormously helpful. Amber Williams is I'm so glad she exists and is helping me dig out. And then we also hired a healthcare liaison that is housed at Impact 211. And that has been Jasmine, who came back to Impact to take on that role. And that's been wonderful. So she is the one who sort of receives all of the assessments and partners with the hospital social workers to assess the patient need. So this has been great because it ties the program into our larger system, so that not only are the patients that are being referred to our program might be connected with our subsidy specifically, but it also gives them the opportunity to receive housing from all of the other housing that exists in the system. And then the other thing that is, I think, really helpful is that it's allowing us to collect a lot of really robust data around the level and scope of the need, because we do know, of course, we know, and our healthcare partners now know that the resources that we do have just don't stretch. It was a really hard message to have for our health partners for a long time. I think health partners, they are used to making a referral, and then once that referral is made, the person receives care, right? That's how it works in healthcare. If you need occupational therapy, you're going to make a referral to occupational therapy, and then that patient receives occupational therapy. And that's not how it works in housing. And that was really, really hard. An analogy that I have been using a lot in trainings that I think has really, really helped is that during when COVID first began, we were all talking about this idea that we might reach this like really horrible, like dystopian future where there is going to be not enough healthcare, and people are going to have to start being prioritized on who gets care and who doesn't get care, based on how successful a treatment might be, or and what resources there currently are versus the presenting need. And I think, and I have told our health partners like that's the state that we work in all the time. And I think that has been really helpful for them to understand, but also emphasizing that even though there is not enough resources, making these referrals is important, because if we can really understand how much need there exists in your system, we can advocate for more dollars. So the partners that we currently have, we're working with Freighter, Aurora, Ascension, and Columbia St. Mary's, like I said, and then we've also spent a lot of the spring bringing our roadshow to all of these outpatient and primary care clinics, and have trained them on this new workflow and our system. I think the children's continues to lead in this space. Not only are we doing the Midtown and next door clinic that we initially started with, but they're expanding into all of their children's clinics. And then they're also doing these assessments in their emergency department, and then in partnership with some of their other programs like Project Ujima, which is a program that helps the families who are victims of violence. So that's been really great. And then the only other thing that's like a little bit unique, of course, is our partnership with the Outreach Community Health Center. They, of course, are already fully integrated into our system. They don't need us to train them on what housing is, but they've been really gracious in allowing us to come in and make them aware of what we're doing, so that they can have a good understanding of what we're doing with the rest of the clinics in the community. I just put in a example workflow. Sorry, this doesn't look correct. Text. But anyhow, so this is how it looks with children's. They are screened for housing instability, and then that's documented in EPIC. If there's an emergency, if it's like a domestic violence situation, of course, we send them over to the Sojourner, Milwaukee Women's Health Center, and everything like that. And then if they're a CCHP member, they still get referred down through the CCHP program that currently exists at the county. And then if they're not, they are assessed and then referred through to our program. And then we're actually working on like a little bounce back between, like if there's a CCHP member who gets assessed for housing, and then for whatever reason, they're not able to be served by that CCHP program, making sure that they're being like sort of like bounced back into our wider system, so that they're still receiving care and we're still aware of that family need. So yeah, into the future, we are hoping that Impact Connect will really help with this workflow, so that the health partners that we are working with can see a little bit of the closed loop, so that they understand what has happened to the referrals that they send in. There's a little bit of a sense of right now that is legitimately frustrating, that when they send in referrals, it goes into the abyss a little bit. It's like they don't really know what happens, but that we just don't really functionally have the capacity to like make them aware of what happens to every referral they send in. They just need to like trust and believe that we've got it, which is not an easy message to follow, so that's fine. The other thing that we've been working on a lot over the last few years is our partnership with Patient Ping, which is being used at BHD now, and we have been pushing over the last few years that the Patient Ping program can also be used with this program. So what Patient Ping does is like you're able to get a roster of patients who are vulnerable for any reason. I think it's often used for patients who are maybe have like dementia, so that anytime that that patient presents in any health system, I think regionally, the entire care team receives a real-time notification that that person has entered that health system. And so we are going to be using that to keep tabs on and provide services to our high utilizers of our emergency departments. Because what typically happens is people will present like in the overnight hours, and then by morning they are in the wind. So if we can receive that real-time notification, not only do we get the notification, but the team at the hospital receives it too. So they know to like maybe keep their arms around that person until we can get there. So that's really exciting because this will be the first use case of Patient Ping being able to integrate a social service team like housing into the healthcare team. That's sort of a new space for healthcare. So that's great. And another, I'm sorry, I hope I'm not taking up too much time, but the other thing that I really wanted to mention is that we did some work with Steve Oley over the last year and Nick tomorrow over at the health department, where we assessed the gap that people were experiencing for respite in the community. So we tracked referrals for a period of time and then sort of put together a report on like how and when people were not receiving respite care. Was it a capacity issue? Was it because of some other reason? And what we did see is that a lot of the reason people were not being accepted into respite care was because of behavioral health concerns. The Salvation Army just is not equipped to deal with people who need respite and also have like behavioral health, active substance use, difficult mental health symptoms, things like that. So we're also working on the idea is we might try to co-locate some respite at our Pathways program, but that's a future thing, which would be wonderful. So, and then the partners that I did talk about, those are our original partners, but there is plans to expand that screening into other hospitals in the county. And I also know that Emily and Erica are taking this model to build out some of the work that they're doing with MPS and with the House of Corrections. And the other exciting thing about this is it represents a decentralization of housing screening. So inpatient partners are completing both the VI and prevention screening, and ED partners are completing VIs. So we've kind of split it up so that each partner was completing the type of housing assessment that they see the most frequently, so that we can really increase our screening capacity without having to build a lot of capacity on our side. And I think that this is the only partnership where people who are not outreach workers or working for Impact 201 are actually completing housing screenings. So that has been great. And they are sending it a ton. I think we've received like 175 screenings just in the last couple of months. And then the other thing is that we're also asking partners to make referrals for all housing issues, including like legal problems, quality and repair issues, landlord disputes. And then those patients are being referred out to Jasmine to other community partners before they even hit the coordinated entry system. So we're also tracking that need that the healthcare system is facing, so that we can maybe get some more dollars from them for that. So that was a lot of information. And so we also provide these category 2 immediate resources for patients. And yeah, I'm really excited about the space that we're entering here.
No, this is great, Emily. Thank you for sharing this. I think we all know how important the healthcare system is to the work that we're doing in building strong partnerships. So this is great. And just also on a side note, the NOFA work group, we talked about this at our last meeting, but we set aside a smaller subgroup within the NOFA work group to look at MOUs, not just for the work that we're doing, with our healthcare partners, but also, kind of COC wide, knowing that the importance of having these partnerships formalized, especially when it comes to, when we're putting together the COC application. So we had our first meeting. It was Erica, Emily, and Emily Whitcomb and myself met this past week. We're going to start meeting more consistently on a weekly basis. Just start thinking about it from a kind of COCY perspective. And how do we start building some of those partnerships and kind of formalizing those partnerships? So more to come on that, but I don't know, any questions for Emily or any thoughts or comments on this topic? Okay. People are super excited about this.
I am. It's okay.
Yes. Absolutely. No, I really appreciate what you guys have been doing with this. And we all know the hospital systems they're massive, massive institutions, but they know the importance. They're starting to understand how important it is for them to partner with us. Just based on some of the populations we're seeing. All right, so if we don't have any questions, again, thank you, Emily, and we will move on. I think I had Eric had a quick comment he wanted to bring up to the group. Eric, you ready to?
Yeah, just really quickly. I won't take up more than 2 minutes. I just wanted to put it out there to folks, if you want to talk to your shelter and outreach staff, that we currently have a supported employment grant through the state of Wisconsin. It's a small grant for $75,000 to serve those who are unsheltered or an emergency shelter on an employment pilot. It's the first time the state, and it's coming through Decker, has done this. It's just $75,000, so we're only doing 15 individuals to start. And we've partnered with Department of Transportation through the county to do bridge maintenance on a number of different projects they have going on over the next few months. $15 an hour. We have everything set up for onboarding through our temp service. And we are looking for folks immediately. The cap is 15, but I just wanted to open it up. It's the first time we've done this. I think it's a really good opportunity. We're looking to develop a long-term partnership with DOT and parks for permanent employment beyond the pilot. It's sustainable living wages. And so we're excited about the potential for this. We negotiated with them for a long time on the onboarding process. They've demonstrated to us that they can be somewhat flexible based on current things, some of the things, that our clients deal with. And so we're hopeful they can find some middle ground on that. But I can send more information to Clara Raphael to send out the group. I'll send the grant application we sent in, which is an overview. But it's a pretty cool setup. First time we've tried this, hoping that we can make this successful so people can move on to good jobs, but also to get more money into the area for something like this in our system. So I'll send it out to Claire, and if interested, email me directly and I'll connect you with our staff who's overseeing it.
Hey, Eric, is it category 1 folks as an eligibility criteria?
It is. I mean, if somebody's working on housing and they're on the street or in shelter and they're about to move into housing, that's certainly fine. We actually are interested in sort of trying to line that up, as people are working on that as well, so they can start working as they move towards housing. There's some flexibility, but that's sort of the core mission of the pilot is category 1.
Awesome.
Good. All right.
Thanks.
Yep.
I
Thanks.
will share it. Thank you.
And Shelley, we had one more quick question for the group.
Thanks, Raphael. Of course, as soon as I left the meeting, I remembered that I wanted to ask the group something. When I was talking to Raphael about these teams, the issue came up, should we, or would you like to invite board members to participate on these task teams? So should we open it up to board members?
Mhm.
Thoughts?
Yes, if we don't mind waiting a little bit longer to meet because availability might be kind of limited.
I think yes. I think it makes a lot of sense to have them involved if they want to be.
Okay.
Yeah, I
Other
think it'd be
thoughts?
great.
I agree. I think that would be a really good idea. And to Claire's point, it might kind of prolong the meeting process because of their availability. So groups would have to be able to be flexible in when they meet.
So do you think these people are busier than you folks? Because I can't even imagine.
Yeah,
That's a good point.
right?
Right. Any concerns? Okay, then we'll open it up. That's all I have. Thank you very much.
Good. Yeah, we have a board meeting next week, so this will be on the agenda. We'll give them an update, and then we'll open it up to open up the invitation for folks to reach out to us to serve on these specific committees. And if you guys, I know, between Tim, Emily, Nancy, and Andy, who serve on the board, if there's any meeting dates that you know of that are scheduled already that we can announce at that meeting to let them know. If you're interested in a specific committee, this group is meeting whatever date, we can also make that announcement.
Kelly, were you planning on being at the board meeting next week?
No,
I am.
unfortunately, I can't. I'll be
Okay.
on medical leave.
Okay. So Raphael, will the board get the information that we just got relative to short and longer term goals and structure and all that?
Yes, this will go out with the announcement, and then give them a little bit of time to review it.
Okay,
And
great, thank you.
Yep.
Raphael, were you asking for us to have dates set for
No.
the?
Well,
Oh, okay.
no, I'm just asking if we have dates set by next week. We can also make that part of the announcement.
Sure.
If someone's interested in that specific committee that's already has a date set. All right.
All right, thanks, folks.
Thanks, Shelley. Just to quickly, the contracts are and will be going out this week. Just to kind of give you guys an update on that end, on both the ESG and CDBG side. So you should be receiving something fairly soon. And the other piece of this is that we want to, I'm not going to say fast track, but we want to get this home ARP stuff moving along. I'm setting up a meeting next week, looking at setting up a meeting next week with Christy at UEDA and to start talking about next steps and dates. What I ideally would like to do at our July meeting, at least start having a conversation with Christy on how we kind of move this forward and start setting up schedules, a schedule for community input. And obviously this includes this group here. But I'll have some more information before our July meeting because I really want to get this started and moving as quickly as possible. Any questions on that?
I know that the timeline's a little long on those. Raphael, do you guys on your end have sort of a ballpark of working with Christy, like having the sort of a plan put together certain time and then deciding on projects or allocations? I know it doesn't have to be spent for a while.
Yeah.
I'm asking too, like I'm thinking on our end, like Jim and I can communicate with you too on our smaller pot.
Yeah. No, I mean, you guys have obviously a significant amount of funds and we want to make sure we're doing this right. But yeah, I think for us, we are You know, would love to get this planning started and going this summer, and at least by the end of summer to have, you know, something somewhat, you know, finalized so that we can start working on allocations by early fall. So I'm guessing this would, you know, may take a couple of months to pull everything together, get community input, you know, fill out the actual, the application itself. It's not, doesn't seem that extensive, but we got to pull a lot of pieces together. So I'm guessing end of summer. Is that, what are you guys thinking, Eric, as far as a timeline?
Yeah, I mean, with the ARPA stuff, it'll be sort of staggered a bit just based on some of the projects that people reach out to us about. I think on the home side, we have a few ideas. You know, our pot is significantly smaller on the home side. Obviously, our ARPA pot's a little different, but
do you have a jewelry repair on site?
yeah, we should connect and sort of we
Yeah.
can give you a timeline and then we can bring that back to the group as well.
Okay. That sounds good. All right. Any other questions on that? Do we have any specific announcements or anything going on?
Hi, yep, this is Andy. So just a reminder that on Monday, the 13th at the Coordinated Entry Leadership Committee, we'll have the first part of the meeting will be discussing the transfer policy. And then we will also be inviting individuals to review the prevention and diversion policy. So I'll be sending out that policy and then the invite today. So that is Monday at 2 o'clock for that meeting.
Okay, thank you, Andy.
Thanks.
Other announcements? Okay. Hearing none, we'll end the meeting almost a half hour early today. All right, appreciate it, guys. Have a great rest of your day.
Have a good one, everyone.